Hi, we're back to BPD Blog, and I would like to discuss today coping skills and therapies for people with borderline personality disorder and their families. One, I would suggest that you seek professional help from a psychiatrist because they will know how to handle your disorder or any other mental disorder. Now, I don't want people to think they're mental, but any type of mental disorders, anxiety, bipolar disorder, depression, etc. Also, discuss medication treatments such as antipsychotics, antidepressants, mood stabilizers, and anxiety medication. Those are the four top medication classes used to help a borderline patient and the other disorders that I had mentioned. Also, I would suggest you go speak to a psychologist and discuss what you go through with your disorder and your problems and your illness on a daily basis because they can help relieve some of the tension and stress that you go through on a daily basis and what you face, and it tends to make things easier on you. Also, there are quite a few therapies that can help as well that I would suggest that you try. There's something called dialectical behavioral therapy. There's something called cognitive behavioral therapy. There's something called schema therapy. There's also something called mentalization-based therapy. There's also transference-focused psychotherapy and regular psychotherapy. I myself do psychotherapy with a psychologist. I also do dialectical behavioral therapy at home on my own and cognitive behavioral therapy due to the fact that there is such a high demand for dialectical behavioral therapy in the medical field and not a lot of places offer it in the state of New York. It is very hard to get into a program. You usually have to be waitlisted, and when you get a phone call, then you can start going into treatment. But they call dialectical behavioral therapy the lifesaver to put BPD patients in remission. And I believe that because I can remember being in so much pain and not being myself for the longest time until one day I just woke up and decided that I was tired of being a victim and I wanted to fight. And I was just diagnosed this past year. I was also hospitalized as well due to a prescription drug overdose from pain pills because I just wanted the pain to go away. And that's exactly what anybody who has BPD wants, the pain to go away. We also have some coping skills for parents and siblings and friends, and that would be that don't try to be a therapist for a borderline patient. It's not going to work. Number one, you don't have the degree or the background to do it, and number two, they're not going to listen to you because they're only going to think that you're ganging up on them and that you're against them. And you want to be there for them. You want to be their friend. You want to be their confidant. You do not want them to feel as though they cannot come to you for fear of being judged, misunderstood, anything. Also, you need to realize that a BPD patient has a very hard time controlling their emotions. So they will mistreat the people that they care about the most because they know that at the end of the day, you give them unconditional love and you will forgive them. Now, in my opinion, I think that people who deal with a borderline personality disorder person should know that it's not their fault that they do what they do. And they are right. You still should love them unconditionally because they have no control over what they do. Their biggest problem is that all they want is to be loved. All they want is to be loved, and all they want to feel is love. But, in other words, you also cannot let a BPD person walk all over you. So what you're going to have to do is do a lot of research into the disorder to find out exactly how borderlines work, how their brains work, how their emotions work, how they can have setbacks, how the anger can come out, how the depression can come out, how anything can come out for that matter. And you need to try and understand where they're coming from rather than flipping out. I do not agree with a borderline attacking anyone because I've done it and it's very hurtful. You should really try and control your emotions if at all possible. But I know that for borderlines like myself, it is hard to control your emotions. So what you're going to have to do then is if you feel as though you're going to have an attack that is that severe, you should walk away from everyone, go in a quiet room, and deal with the attack on your own if at all possible, and try. I know it's difficult, but the best medicine is to try. You don't lay down and let something beat you. You get up and you fight back and you beat it. Now, some coping skills for you guys would be writing in a journal, doing focusing exercises, doing peer counseling. Now, peer counseling is when you call two of your friends, close friends, that with whom you trust, and you sit them down. You sit at the head of the table and sit them on either side, almost like court, and you explain to them your issues. Each person is going to give you their personal opinion to the situation. Now you can take one person's opinion and apply it, or you can take both opinions and apply them together in different ways and take a little bit from each and apply them in your everyday life to help you. Because that's what they're here for. They're trying to help you. And sometimes borderlines feel most comfortable talking to people their own age. And I'm talking about younger and older people can do a peer counseling because peers are just people who are the other half of you. It's in your age bracket, it's people you know, it's people you're comfortable with. You can also try going for something called a timeout in a comfortable place where it's just quiet and relaxed and you're calm and you just sit there and wait for it to pass. You can try doing community service. You could try doing vigorous exercising. You could even try going for a long walk. That'll sometimes help. There's also more. Try playing music. It tends to create an emotion opposite of the one you're feeling. Which means if you're happy, play happy music. If you're depressed, don't play depressing music. It sinks you in deeper. If you're angry, do not play angry music like rap with cursing and yelling and flipping out and I'm going to F this one's mother and I'm going to punch this one in the face because it's only going to enrage you more. And that's not what you're looking for. Also, try doing something like watching TV or going on the computer and engaging in online activities as well as regular activities, or instead dance, clean the house, put your emotional energy into a positive activity and turn your emotional energy and negative energy into positive energy. That's what I do. When I'm upset, I'll go on the computer and I write my blogs. When I'm upset, I will watch a movie. When I'm upset, I will have a conversation with my mother. But that's me. Also, calling someone or reaching out to someone who's supportive, such as a family member, good friends, a partner, a confidant, anyone who can help make you feel better is good. And you can also call the suicide hotline at 1-800-273-TALK. And they can always help you. And not just for miserable cases, but for the case that, how can I explain this? For the case that it could be anything. You can be depressed, you could just be having a bad day. And then they will talk to you and make it better. Again, that number is 1-800-273-TALK. A lot of people believe in praying. When you're a spiritual person, you tend to feel that a higher power can help you. I am religious, but I do not believe in a higher power in that sense. I know that a lot of people do. So if that's what helps you, then I believe that you should turn to your higher power and see if by talking or praying or just sitting there silently and reading out of a Bible or a Torah makes you feel better. Then there's another thing called write it out, which is when you grab a stopwatch, you breathe, meditate, and focus your energy on positive thoughts for 15 to 30 minutes. And by then, the mood should have passed, and you should have gotten through it through breathing, meditating, and focusing. And that doesn't always help everyone, but it does help a lot of people. Another thing, be mindful. Notice the emotion and let your body just experience it as a wave. Just try accepting the emotion for what it is. When an emotion comes along, like depression, it's a wave and it just curves and keeps curving like that. Follow it. Make your body follow with it, okay? And then you can just curve along with it so that there's no issues. And this is how we deal with emotions in that sense. You could also try sitting down or lying down and do breathing exercises. Just focus your attention on your breathing pattern. Watch your stomach go in and out. Watch your chest go in and out. And for the fact that you're putting your attention into something else, by focusing on that, you will literally start to forget the emotion and it will just pass. And lastly, take a warm bath or a shower. The smell of soap, scented soap, the feeling of water has a calming effect and a soothing effect on you. So it tends to distract you from feeling any sort of negative pain. Now the best way to do so in thinking about this is to literally, most people I recommend that they take a shower because the noise of water sounds like rain and it's most calming. A bath you can sit and relax, yes, that's true. But in the sense of the most calming, a lot of people think that showers sound like rain outside, and rain tends to calm people down. Now, I myself go through the ups and downs of BPD on a daily basis, and I don't think it's easy for anyone. Those are just some things you can do. Everyone has a different way of coping. I've given you quite a few coping skills, not only for yourself, but for your family members as well, so that they might help you. Now, I don't know how you all feel about the situation, but your best bet is not to lay down and take it lightly. It is to sit down and fight. And by fighting, what happens is you fight and you fight harder and harder. And before you know it, you're not in any more pain. Until next time, I hope this was helpful. Have a good day, guys.